Welcome everyone to tonight's online community forum to talk about the coronavirus and how it is impacting people in our community. My name is Pam Duncan, and I am the President and CEO of Metropolitan Development Council, also known as MDC. And we are joined today by my good friend and colleague, Tawina Nobles, President and CEO of the Tacoma Urban League, and we are partnering together for this series of conversations. So I'll turn it over to Tawina.
Thank you, Pam. Everyone, tonight's conversation is the third in the series of discussions where we are diving into the different ways that the virus is impacting Tacoma and Pierce County. Tonight, we have a panel of local experts to talk about the impact COVID-19 is having with those who are currently homeless in our community. We'll be here for the community throughout the entire COVID-19 crisis with our conversations every Monday evening at 5 p.m. The most important message throughout this series of conversations is that there is hope for our community. And our focus is to create space in each meeting to talk about resources and things we can all be doing to help through this get through this pandemic.
Throughout today's conversation, you can submit your questions to be addressed by our speakers using the question and answer function in Zoom. While we cannot promise that we will have time to consider every question, we will make our best effort to get through the list in our allotted time. And then as a housekeeping matter and for the security of everyone on this call, everyone's mic has been muted and we are not allowing everyone to show their faces on video. We have also disabled the chat function, so please ensure that you submit your questions to our moderator through the Q&A function. On the line with us tonight for this call are four experts: Dr. David Hirschberg, Gerrit Nyland, Colin DeForrest, and Jan Runbeck. Gerrit Nyland is the Director of Client Information Systems at Catholic Community Services. He co-chairs the Tacoma Pierce County Coalition to End Homelessness, is a member of the Pierce County Coordinated Transportation Coalition. Wow, Gerrit. Co-chairs the City of Tacoma Transportation Commission, is a board member with Communities and Schools Tacoma, is a board member with the Northwest Furniture Bank. He has a BA in history and a master's of librarianship and enjoys backpacking, cooking, sailing, and anything involving trains. Welcome, Gerrit. And then Jan Runbeck is the administrative lead of Pierce County Medical Reserve Corps, a nonprofit that has healthcare professionals who respond to public health emergencies. For example, in 2009, the Pierce County Medical Reserve Corps administered just under 10,000 vaccinations during the H1N1 outbreak. MRC has been activated several times in response to the particular needs of those living homeless here in Pierce County, such as through Pierce County Homeless Connect. Jan has been teaching at UW Tacoma School of Nursing since 2016. Welcome, Jan. And then Colin DeForrest is a born and raised Pierce County resident. He graduated from Western Washington University, and one of Colin's passions is finding innovative ways to communities and individuals struggling with homeless-related issues. Recently, Colin started his own consulting agency, Innovative Impact Strategies Consulting. His work focuses with local communities around the management and implementation of homeless services and strategies. Most recently, Colin was with the City of Olympia's Homeless Services Unit as the Homeless Response Coordinator, leading to the implementation of multiple homeless response interventions. Thank you, Colin. Welcome on board as well. Last but certainly not least, Dr. David Hirschberg is Assistant Professor of Clinical Pathology in the Mailman School of Public Health and the Chief Technology Officer for the Center for Infection and Immunity at Columbia University, and he is the principal investigator in the Department of Interdisciplinary Arts and Sciences with the University of Washington, Tacoma. Dr. Hirschberg is also the founder of the RAIN Incubator that's located right here in Tacoma's Hilltop, and we are so fortunate to have him on board as well. Welcome, David. Welcome, all of you. And so we will now go ahead and get started with our questions.
Can everyone hear me still?
Yes.
Okay, great.
Yeah.
So I'm going to offer up the first question to the panel. How is the virus impacting those who are homeless right now?
So, Colin, would you like to start?
Sure. You know, I think it's kind of a loaded question. Honestly, I think what we know is that when we think about social distancing and all the things that we're learning as we're kind of going through this pandemic, and then anyone who's spent any time, whether it's at a shelter, unmanaged encampment, kind of any areas where maybe individuals experiencing homelessness might be, you really see that kind of the way that they're living kind of flies in the face of what we're learning. So I think that obviously the impact is great on this population. I think one of the challenges is really kind of truly knowing, because I think what in the short time in this work that I've done with the pandemic, I think what we know is it's just really challenging to get this population. It's challenging to get this population to engage and feel safe and engaging, even if that's with getting housing, right? So I think once again it's a challenge. I kind of think of it like the homeless point in time count, which is a great service, but I think what we know is oftentimes it's so very underrepresented. So I kind of feel my concern is that's the same way with this, even though we might not see these big numbers. I think the question is I don't think a lot of people are getting tested. So I think it's challenging, and I think that it's probably impacting them or this population a whole heck of a lot more than we are aware.
Thank you. Would others like to respond?
Oh, I'll jump in. This is Gerrit Nyland with Catholic Community Services. I think that that if we think about our folks experiencing homelessness kind of in two big groups, the folks that are living in shelters, and here I'm speaking particularly about our single adults in congregate shelter, they're at an incredibly high risk of contracting COVID-19. They're largely unable to isolate themselves or keep themselves in their home. Because they share a space with a huge number of people, and the air is flowing everywhere, and it probably has COVID-19 in it. So most of us have worked hard to move our vulnerable. So right, anybody that looks like they'll be on a ventilator or in a coffin if they get COVID-19, we've tried to move them into hotel rooms or into spaces that are much better designed to prevent the spread of disease. And I think one of the big impacts on people that are unsheltered is the lack of resources. They kind of made a patchwork of community resources like, washrooms at a Starbucks and Wi-Fi at a cafe. They had access to food from soup kitchens, and they washed up at the library, and they spent their day there. And all of those places are largely unavailable to them now. And so what used to be a real challenge in keeping clean is in many ways nearly impossible for a lot of our people living in their cars and on the streets, which is most of our homeless in Pierce.
Sorry.
Jump in, Jan.
Okay, I so rudely interrupted you there. I want to give a huge shout out to our providers of services for those who are helping people who live homeless. I have worked with Colin and Gerrit for several years now, but this COVID-19 pandemic has reached sort of a new pitch in our service provider community. There are two very large shelters in our town, Tacoma Rescue Mission and Nativity House. Both of those settings have been very aware of the danger of COVID and what it means. Like Gerrit said, you know, you can end up in a coffin. We were able to come together with some community partners and provide a somewhat immediate response for some of the men who were exposed to confirmed COVID cases from Nativity House. And it was a real joining of effort, because everybody understood, those of us in the public health realm understood the urgency. But the men who came, the people that we served, were so highly respectful and highly appreciative. And Colin and Gary, you can jump in here. It was an honor to be able to be with them as we joined together, shoulder to shoulder, to fight this disease. The disease is no respecter of class or anything. So it's been a real, just as far as a provider look on it, it's been a real honor to work with folks together to try to increase social distancing in a nearly impossible setting. So thank you to all of you.
I think it would be good right now to, having heard what we've heard so far, to highlight why is it so critical to have a special discussion about the impacts of coronavirus on those who are experiencing homelessness. Dr. Hirschberg, would you like to weigh in on that, please?
Well, I would echo just the comments that have been said, that this is an incredibly vulnerable population. And, you know, the virus really tends to hit these populations harder. So these are, you know, any population that already has other challenges. This is just one more thing added on top of it. It's not an either or. So if they're facing other health challenges, nutrition challenges, you know, if the, you know, just everything else, just staying clean, being able to, you know, wash your hands, social distancing is very hard to do. Many of these challenges that we're all facing now are just dramatically increased in a population that doesn't have these resources to start with.
Thank you. Would others like to chime in? All right. I have another question. I'm actually gonna mix it up a little bit and pull a question from the Q&A box, so that we don't move too far down the line and not talk about youth. Can you all share how are youth experiencing housing insecurity, but also who might have a positive or pending COVID-19 result? How are they being supported during this time? So youth who are experiencing housing insecurity, if they are positive or pending test results, how are they being supported during this time, if you know?
Well, there's the hotel, the health department and the EOC, the Emergency Operations Center, has a hotel on South 72nd for folks who cannot quarantine at home. So basically, by definition, that would include any persons experiencing homelessness and other congested types of home settings. So that is not age dependent. It is by referral. It's a triage system, and you go through the health department. There's a phone number that providers can call, and they can be quarantined or isolated at this hotel. So there's 120 rooms set aside for that population, and it would include youth. So that's what we're doing as far as a public health sanctioned response.
Thank you.
Thank you, Jan. How would you define the changes that have been made to create more social distancing and shelters? How has that been impacted? How has that shown up, and how has it impacted access to the shelters?
I can jump in with the Nativity House, which is a large single adult shelter. So that facility housed before the crisis, temporarily sheltered 167 individuals per night, men and women. And we probably had around 300 people in addition to that coming in to use the day center for breakfast and for lunch. And with the need to social distance, we needed to remove a significant number of those people in order to get 6-foot sleeping space and 6 foot between different folks in the day center. And so the changes we had to make were we moved about 60 folks out of the shelter into hotels. And that's an expensive way to do it, but it's also the only way that I could see where we could really have our most vulnerable able to have control over who they came into contact with. And that removal allowed us to house the people we had in the shelter more safely. And we've actually allowed that number to drop significantly even further as people left the shelter for housing or for other places. We haven't added people back in. And we also shut our day center down to any people coming from outside. So the big impact for the people in our shelter is it's a safer environment. But the other impact is we're no longer able to provide an indoor location for people to get meals. And we're down about 30 people in our shelter that we used to serve. So instead of 167, we're down around 120. And we're actually seeing fewer people come for food because I think they came for food, but also for a social environment. And with that gone, they're getting bathrooms in our parking lot with porta potties, and they wash their hands with sanitation stations, and they get meals. But it's really not driving as many people because of the services that have been cut.
Thank you very much. Would others like to comment on that question?
I can answer on part of what Tacoma Rescue Mission has done. They partnered with Bellarmine High School and to increase this bed social distancing, like Gerrit was describing in Nativity House. They did that same modeling at Tacoma Rescue Mission. And to increase the bed capacity, Bellarmine Gymnasium is a nightly shelter for the men who would have stayed at the Tacoma Rescue Mission. It's my understanding that Bellarmine offers only the nighttime sleeping option, and that meals are still at Tacoma Rescue Mission. But another population that is greatly impacted by this is folks who were experiencing homelessness, went to the hospital for any other reason, not just COVID, to rule out COVID, but people still have heart attacks and broken bones and things like that. The hospitals now are at a loss of where to send folks because Nativity House and Tacoma Rescue Mission are being very diligent about the social distancing, so there's not any extra room anywhere. So I am very afraid that many of our folks who are living homeless are ending up in the streets or ending up in very crowded conditions, who are being discharged from the hospitals because there is nowhere for them to go.
Mm-hmm. Mm-hmm. Yes, because as Gerrit was talking about the having to just really downsize the census so that you could really enact social distancing, and then the same with the rescue mission, it really begs the question of where did people go? I should add that in addition to those shelters, there is the family shelter that Metropolitan Development Council is operating out of Bethlehem Baptist Church. That had been initially an overnight shelter for families, couples, and single women. And it has turned into a 24/7 operation because of the facility that the MDC is operating that shelter in. There is ample space for people to be there 24/7. So there hasn't been a downsizing in the census. But it does present the challenge of when people want to go in and out of the facility and how you implement protocols to ensure that folks aren't unduly subjecting themselves and others to the virus. So
Actually, can I jump in for a second, Pam?
Yeah.
I was just going to mention that we do have a number of shelters that are operating as usual because they design their shelters as non-congregate living. So YWCAs, domestic violence shelter, our apartments, KWA, similar situation. The Adam Street Family Shelter that the Rescue Mission runs, again, separate bedding areas. And so they're safe places. So they've largely been able to operate unaffected because their facilities are much better designed for keeping people apart.
So speaking of design, actually, and I would like to ask a question about system design. And along with this question, if you can tell me about your agency or colleagues, but also if you have gleaned any information from the homeless community themselves or community members currently experiencing homelessness. So we know that this crisis, this question is coming from our Q&A box, but this crisis is further highlighting the inadequacies in our shelter systems and the lack of market rate and subsidized housing. Knowing what we know now, what system designs would have been best to implement to mitigate COVID effects upon the homeless community members in our city, in our county.
I could talk just real quick, and give my little 2 cents on that. I think for anybody who's done this work, as many of us have for years, what we're seeing right now is, just the light being shined on all the gaps that are in this system. And these gaps have been there for years. We've all seen these gaps. Unfortunately, it's taken something like this crisis to really the larger community to see these gaps. So, I mean, these are things that have always been there. We've always had a challenge with hospitals discharging and not having places for people to go. We also, I think to your point on system design, we've also struggled to really hear the voice of this population, even for us that are most closely working with this population. To hear the voice of them can be really challenging. And I think what some of the work that I've done recently has shown is and we know this, there's a huge portion of this population right now where they're at, they feel safest living in an outdoor setting, right? So I think we will continue to see that, and that is a need. We have communities around that are responding to that need and hearing that voice, and rather than saying we're not going to allow encampments or anything like that, what they're doing is they're setting up managed sites. The city of Puyallup has a managed site down by the Puyallup Rec Center that's working really well in response to the COVID-19 crisis. So I think part of it is just really being willing to hear that voice of these individuals, and they're going to tell us what they need. I think some of the challenges, like when Janet describes with the hotel on Hosmer, that's wonderful, and it's a great service, and I think there's a lot of people that are taking advantage of that. But I'm also very aware, and I think we all know, there's a lot of people, for whatever the reason may be, and that really doesn't matter, they will not go there. Right? And we need to say, what we need to do is we need to find those people and meet them where they're at and serve them in that population. So as bad as it sounds, I think for a lot of us that have really been in the trenches for years, this is really shining the light and making people ponder and feel the ickiness of homelessness in a different way now, right? An example is like when someone gets discharged from the Hosmer site, it's like, okay, this individual's gotten better. Let's say if they're experiencing homelessness, well, where do they go to? Well, we all know where they go to. They go back to the street, or in best case scenario, they go to a shelter. So I think for the larger community to feel that ickiness of like, really? They just go back, like that's where they go? That's wrong, right? So I think that to me, and that's what's wonderful about having these conversations and this is an opportunity for us to really look at our system, which is a great system, but also identify and focus on those gaps that we have within this system and say, dang, what can we do to respond to this, and how can we fill these gaps?
So essentially what I heard you say, Colin, it is in terms of the systems designs that would, knowing what we know now, that the design would be to just really provide a variety of responses or designs that just really address the different needs and where people are. So for some folks, that's the situation, like you said, that exists in Puyallup, and in other places, it's providing, maybe a single room occupancy, or it is a different type of affordable and subsidized housing. But it's definitely not to ignore that there are folks who whose needs show up in a different way.
Totally. And it's the basic stuff like Gerrit talked about earlier. I mean, I think that he shined a light on that so greatly. Like, it's the game that this population plays on a daily basis to meet the basic needs that all of us it's just a part of our daily thing. A shower, going to the bathroom, this, that, the other, getting my Wi-Fi here, like this is a survival mode that these individuals have honed. That's honestly so impressive and amazing, the way that they navigate this system that is not set up for them. But now that system is it's gone. So once again, so much of that stuff it's just these basic things, like, where do I go to the bathroom? Let alone where do I shower? I think obviously we have the wonderful shelter system like TRM and the Nativity House and some of the other ones that we've talked about, MDC, but there's still so many gaps, and it's just the basic stuff.
Well, can I ask a design question of Dr. Hirschberg? I had the pleasure of hearing him being interviewed today on KUOW to talk about his incredible work with early epidemiology, discovery of viruses in geographic locations. So, Dr. Hirschberg, would you see your sewer system, early detection sewer system, being part of a new design for congregate living in different populations?
Yeah, I think it would. I mean, there's always kind of a worry, like, when we talk about surveillance, we're really not, this isn't surveillance in the sense that we're looking in on exactly, what each individual person is doing. But in a population, I think it's really important, like in a community or, in a housing situation, if you could remotely monitor sewage, you may be able to do early detection. So that it's kind of like an early warning. It would be like having a smoke alarm installed, in the sense this is the biosensor that would go off and kind of give a warning. It could be for a pathogen, but it also could be other indicators, could give you something about the health of a community. And so what are the good things going on there, and how can we encourage basically those good indicators?
So here's another question, and at some point it'll loop back to Dr. Hirschberg, what you are sharing. So we know, we've already discussed why it's important to talk about the intersection of folks experiencing homelessness and coronavirus, because of the underlying conditions that they folks might have, and just not being able to shelter. But is there any sense, is there any information, what do the data tell us about, are there elevated incidences of coronavirus Are you seeing that in any community, whether it's, here in Pierce County, regionally, or across the country? What do we know about if there are elevated levels of coronavirus in this particular population?
So what I can say is that it is early in our studies. So I have no evidence right now that any one population has a higher level than another, as we can measure from this kind of, in a sense, standoff way where we're not individually going and doing this. I do think, the community, actually the nation, the world is really talking about increased testing. And we've already seen that in countries that are offering increased testing, that's the molecular testing, but also the serology, which tells you a little bit about the antibody status, that's the herd immunity. You can quickly understand and realize where resources are needed. And certainly, I would suspect that the homeless population really has been underserved in this case, and it's would be critical to really divert resources and really get some data in. And I'm hoping in the next couple of weeks we'll be able to help spearhead an effort to do increased testing in these communities, either from direct testing. And I think that's going to be critical. Obviously, this is something we can do directly. We don't have to wait to monitor sewage to do this. We're hoping that the monitoring of systems like sewage systems will reflect this. But I think monitoring, being able to really rapidly assess who is carrying the infection and who has resistance to it is absolutely critical.
So how does, and this is for anyone, how does Pierce County compare with King and Thurston counties in the effort to provide the necessary PPEs, the masks, the gloves, or other barrier-causing equipment to the homeless population?
Well, as someone with an agency that operates in all three of those counties, one of the real interesting parts of this is how incredibly different each of those counties has to be worked with. Not incredibly different, but it's like it's three whole different systems. And I think part of our response to COVID-19 has sort of highlighted just how kind of local things function. So we occasionally have to move PPE around a little bit because it's available somewhere and we're out at another location. Just throwing that out. So we definitely have those problems, and we embed in our thinking what's possible based on what PPE is available, right? So certain things aren't possible if we don't have enough equipment to make our staff safe. Like, I don't know that I would send people out into encampments right now because even though that's a pretty safe environment to go into, I don't have additional PPE in stock in order to make that happen within Pierce County, right? But I might be able to do that in King County because it's a different flow.
But you know what? I think this was a great question, because it makes you think about PPE is also necessary for the folks we serve. It's not only for our staff. And so what efforts have you seen in terms of the distribution of things, but especially the masks, to the folks who are experiencing homelessness? Have any of you seen that?
Oh, sure. Yeah. So like in Thurston County, we have a congregate shelter, a smaller one. And basically our entire facility, it's got a lot of permanent supportive housing, and we provide reusable masks to everybody. And we do the same thing with our shelters in Kitsap County because we've been able to source them. Most of them are reusable, but yeah, there's definitely a sense that within our staffs that what is necessary for our staff is necessary for all of our clients. And again, it's worth noting there is nowhere else in Pierce County except our congregate homeless shelters where everybody is in a bay setting, right? Like it is only our homeless that have a living situation in our congregate shelters where they're sharing space in this way, which kind of is a heartbreak.
So how have we been collecting information in Pierce County? How have we been gleaning information from those folks who are experiencing homelessness about how their needs have changed?
The EOC and the health department does have a team that's dedicated to trying to serve the need of those living homeless, and they are in contact with the service providers. The particular data or efforts I'm not aware of right now, but I do know that there's some active engagement between the health department and the service providers for those living homeless.
So do we have examples of specific needs that folks have elevated besides the obvious, which is housing? But are we aware of other specific needs that have been elevated from folks who are experiencing homelessness?
The main messaging has been social distancing. Whatever we can do, that's been the main focus, is social distancing. So whatever logistics can be provided that would maximize social distancing is what I'm aware of.
I hear a lot. So this is Gerrit again with Catholic Community Services, and most of our service providers, people experiencing homelessness are part of our everyday lives, and we run really strength-based kind of operations. So a lot of our work is constantly analyzing and trying to draw out of people experiencing homelessness what their needs are. How that relates to COVID-19, I'm not so sure how well we're doing on that. Just because, I mean, we have very active work we do, one-on-one meetings, we have focus groups, like a lot of our contracts require it, like a lot of our work requires it. So we do that. I don't know how much we've been able to do some step back and do anything like that in COVID-19. But one thing that's kind of interesting is a lack of information. A lot of our people living in encampments have identified that they're largely, especially, weeks after, you would expect everybody knew everything about COVID-19. They were largely unaware. And they don't have access to charging for their phone, right? They've lost access to the internet, so they can't communicate with other people, right? Our ability to communicate with them and for them to receive information has been dramatically altered. Like in one way, like we were talking, so this is my census plug. So I'm working on increasing census. Hopefully you've all responded to the census already. Increasing our census response. But for so many of our folks experiencing homelessness, all of the communication tools that I expected to use are largely unavailable to me. Day centers aren't open. They're not going to see posters in libraries, right? So that's one big thing. And that's been something that folks have mentioned, that how am I supposed to know what's going on? Or people that moved into our hotels, they were like, wow, I turned on the news and I learned all sorts of things I was unaware of.
Yeah, I think that is great information, and I agree. Going out to the camps, when we're really in the heat of this, camps in Tacoma, camps in Thurston County, and individuals just not knowing much at all. And I think that's extremely concerning. And then I think what we also know about this population is many of our most vulnerable are also our most challenging. I mean, all you have to do is drive down Tacoma Avenue by McDonald's, and look to the right. And, there is no social distancing going on right there, right? And so I think that's really challenging, because the people that really, really probably are the highest risk are also, they're involved in behaviors and a lifestyle that is extremely not doing it the right way right now. And some of that has to do with survival mode. Even the social distancing. Well, when you're living on the street, you're going to want to, individuals usually stay in packs, so, and you, especially if you're a female, you want to stay kind of close to someone that's hopefully going to protect you. So it really is, it's just really kind of their way of life is just being really knocked on its side, even, you know, and so, yeah, I think that's really interesting. And I think that, but I think to Gerrit's point, the information is what I've seen is the most concerning. Like, wow, individuals there's just a lack of information, you know.
I'm glad that you brought that up. That's actually the whole driver for these conversations that we have entitled Straight Talk, because we thought about all of the folks in the community who don't have access to the information that we are inundated with day in and day out. We're on webinars, Zoom meetings all day long. We're hearing the most current, up-to-date information about what, you know, the stay-at-home order, or, you know, the distancing, or new you know, recent developments about coronavirus. And we also realize there are so many folks who don't have access to that information, or they've tuned it out. So you really elevate a challenge in terms of how do we reach folks who are in encampments, who are, and not just for the census, that is important, but for right now information and how to help them to be safe given their circumstances. And then Colin, because I know that you frequently were in encampments when you were working here in Tacoma, how do you see that playing out? How do you see anyone who's going into, who's reaching out to folks, what would that look like now?
Yeah, I mean, I think it would probably look very similar, you know, obviously to Gerrit's point, ideally individuals are going to have their PPEs on when they're visiting the camps, but I think it's what they're bringing to the camps, whereas before it would have been a candy bar, a granola bar, and some water. Well, maybe we're bringing some more information. Maybe we're bringing some masks and things like that. So I think the tools and the resources are still the same, but there's also, I'd say I would see them changing ideally. And then I think, you know, to the point of getting that information, I mean, we can bring that up and we can pose that and we can all go, gosh, yeah, that really sucks. Those people they're not getting that information. And then we move along to the next question. But the reality is, like, this is a life or death stuff. And that's not changing. Like, they're still not getting that information. So I think we need to really focus on how do we get that information to them? Is it something like, you know, is it having monitors on certain areas of downtown where there's an update going, you know? I mean, we have it at the gas station. There's ways of doing things like that. And I think we need to really start thinking outside the box once again through that equity lens of, like, do we genuinely want to get that information to this population? Because to this point, I would say we do, but the actions aren't exactly backing up the words, because we're really not doing, it's still the same. I mean, I drive down Tacoma Avenue every day. Those people are, you know, it's only growing the amount of camps along Tacoma Ave, and I think that they're not getting information. So we need to figure it out. Yeah.
But Colin, I have a question about that. In the world of medicine, we do not screen unless we can treat or at least prevent. So this is a population. They actually trust us as medical folks, and they trust you as service providers. So they trust the information. But then what? We can walk in with information. We can walk in and tell them how awful it is. But then what? If we don't have a solution to either their outside living or their shelter living, it's almost a cruelty for us to walk around in face masks saying that you are now exposed to this awful thing. In fact, there was a study that came out of Boston that said over 40% of this one homeless shelter site tested positive. Over 40% tested positive. And I was wondering if Dr. Hirschberg could answer that as far as, is there a way to do even the sewer testing for viral load? Would you be able to find higher viral load and then determine if that area had higher incidence of virus?
So that is the hope, but it is way too early to be able to correlate anything we're finding with actually viral load. And so we just couldn't prudently be able to do that now. I mean, my feeling is that, you know, this is going to be necessary to do direct testing. The other way you can independently do this is I'm getting a question, what is viral load? So it's really the amount of virus in a system, like how you know, the quantity. So most of our tests are very quantitative. And so right now we're detecting very low levels of virus down at the physical plant. And as we move through the system, we may, in some cases, get increases, but it's too early for us to understand now whether somebody discharging treated waste into the system is destroying our signal or alternating it in some way. So that's why to really get accurate measurements from population, you either need to do the direct testing, molecular testing, which again is you know, it needs to be, there needs to be enough kits available, but that is usually done now. It's very easy. It's done with either a fecal swab, or you can do a mouth swab. You don't even, a throat swab. You don't even need to do the nasopharyngeal swab. And then secondarily, a very, you know, small blood prick, really a very, like drawing the blood, very like just a tiny a prick. It doesn't even have to be a whole, you know, like 10 mils of blood. It just needs to be a pinprick, can give you antibody results, and which would give you some information about the amount of antibody circulating in a population, and that correlates with exposure.
Thank you.
So how could, Dr. Hirschberg, how could we as a community create access to testing, especially for our most vulnerable, so that we at least can begin to have some data?
I mean, I think we need to create more widespread testing. The tests are relatively cheap. They need to be, this needs to be expanded. They need to be available. And certainly being able to even anonymously collect information. So you can, if you would consent your population, but the information doesn't have to be an individual report back. It can be looking at across an entire population. And that way, if somebody's concerned about revealing their identity or even their status, it can be anonymized, and really you can report back population data, which is, for public health reasons, or for public health reporting, is very, very important. Additionally, it would be great to educate so that individuals understood that you know, their actions can have consequences. Who you shelter with, you know, to keep everybody safe, it would be good to be able to understand everybody's status. And so testing often and being able to make these tests available to the officials, to staff, working with people, I think is of the utmost importance.
Thank you.
I had a little question about that. So,
Yep.
so without comprehensive testing in our shelters, it seems like just a little bit of testing doesn't do us much. Like, we basically need to operate our shelters as if everybody's positive. Like when you look at like that Boston, that Boston case study where they had like 40% of the population asymptomatic positive, assuming the tests were valid. There can just be a lot. Like if you can't do frequent, large-scale testing, are there benefits other, like, I don't know that we would change our program basically based on information about how many, I don't know what I'm asking. So like, does the amount of testing need to be present in order for us to be able to make good use of it? I guess that's my question.
Well, I think it does, and I think within the next few weeks, we probably will have much more testing available. But I think even getting a snapshot now is important. I mean, clearly, what's going on in a major city like Boston or even New York is very different than what's going on in Pierce County. So we do know that the levels of the virus are lower here. And because of density, it's spreading slower. So I think it would be very important to get a snapshot to know how serious the problem was. And then the other thing is if we can get even a snapshot of a week later or 2 weeks later, then you have some indication of change.
Mm-hmm.
So I think these are important now, but I agree with you. The more we test, the more we can isolate groups of people that are positive. I think then you get away from the everybody is assumed positive scenario, which takes a lot of resources.
Right.
So I just want to do a check-in and also thank everyone, all of the audience that has the folks who have joined into this call, and just remind you that if you have any questions, feel free to post them in the Q&A. We have a couple more that have been posted and we will be responding to them. I am going to turn the floor over to Twyna so that she can also post some questions.
Thank you very much. I have a couple of questions, so I will start with the first one so I don't get anyone confused. But let's talk a little bit about the data. Excuse me. Do we see any changes in the data yet about the rate at which our community members are becoming newly homeless during this crisis?
I'll take that one. This is Gerrit with Catholic Community Services again.
Thank you, Gerrit.
It's really challenging to know how much is because we have less demand and how much is because we have fewer places for us to meet and interact with people experiencing homelessness. However, over the last month, when we had our initial drop in numbers, we've basically come back nearly as much with our coordinated entry system, which is our front door to homelessness. And we haven't come back with as many people coming into shelter because we don't have as much shelter space available. So I don't know, and you would think with the moratorium on evictions that you would have a drop in the number of people newly experiencing homelessness, but just looking at last week, well, the week prior, so the week prior to last week, we had 200 people in Pierce County start a new episode of homelessness. About, let me look at that number really quick. About 140 of them, it was the first time they'd asked for help from the homeless system before. So that's not atypical for a March, April week in Pierce County.
Thank you. Would anyone else like to respond? All right, I have another question, and if anyone decides that they want to respond to the data question, feel free to jump in. But can anyone speak to unintended consequences? So right now, we'll take restrooms, for example, for our community members who are currently homeless. So at the very time that they, need access to hygiene, there's the lack of access to restrooms or, lack of resources. But any other unintended consequences that you all have noticed or seen that you can share with all of us?
This is Colin. I would just say, I think to me, it's not, I think there's an increase, and I think Gerrit touched on it perfectly in the beginning. I think that the libraries are really a de facto shelter in most communities. So just the libraries not being around is that's a huge one. But I think more than anything, what this does is, yes, there's unintended consequences, but I think it just shines the light on what's really going on. There's just so many gaps and so many things. So to me, that's where I kind of always go back to, is it just really shines the light on showers, bathrooms, the lack of these things for this population, safe places to be, safe places to sleep, just living, So, but I think, a lot of the go-tos, the Safeways, the this, the that, the other, I think that there's not so much of it is just, I just want to get off of my feet. I want to sit down somewhere. And that's a big piece of this, is like, don't sit down. You can't sit down here. Right. So that's a really big piece, and that's something that we don't think about. But when you don't have a home, you spend a lot of time standing up, especially when you sit down on a sidewalk or something, you're saying, hey, you can't be here. So just having a place to sit and maybe eat, maybe just collect your thoughts, maybe sleep, so yeah.
Can I jump in here?
Yes, please.
I think one of the hidden populations, and Gerrit and Colin know that this is something I am working on, is when you lose your home, you may still have your car. And those folks don't sleep in encampments. They don't sleep in shelters. They don't sleep. They may be doing some sofa surfing as long as they can, but they do keep their cars. And the safe parking model could be something that this town and this county could be offering more, just through some good partnerships, through some, funding, just having your car. So I know folks on this panel know that this is something that we're all aware of it, but the data is hard to get. This is an invisible population. It is hard to get a count of how many folks are sleeping in their cars. The city of Tacoma has agreed to not issue tickets for people who are parked over the number of hours that are allowed to park. But still, we don't have any good data unless somebody does. If somebody's got some data on where and who and how many people are in their cars, it'd be easier to fill out the requirements for the grants, let's say. So my guess is a growing population for which we have no good hard numbers.
Thank you.
Yeah, and a big reason for that is they remain hidden. Like, a lot of people in their cars have grief and unpleasantness when they're identified and noticed. And so they work very hard to remain uncounted. And like you say, like, a lot of, like, did you know every YMCA in Pierce County used to offer free showers every morning before 8 o'clock and after 5 o'clock to anybody experiencing homelessness? Yeah, that was a tool that, hundreds of people used on a regular basis. That's gone because the YMCAs aren't open right now. I was going to jump in on I'm talking too much, but another unintended consequence, and something we're seeing with a lot of our homeless families staying in our hotels in Seattle and Tacoma, is that there's been a rise in domestic violence that we're at least being aware of, right? But two of the big drivers in domestic violence are time you spend together with your family and financial hardship. And you kind of package both of those bad boys together. And there's just a lot of strain in households, which is causing a real spike in domestic violence. We're definitely seeing it in a number of ways. But I think that's not an unintended consequence, but sort of collateral damage from the work we're doing to kind of socially isolate.
Absolutely. Thank you.
Hey, Twina, before you go to the next question, I also have an observation about unintended consequences, and it is really, where did everyone go? So for anyone who has driven, walked down any street in our community, you don't see folks. And what I'm wondering is, where did they go? That's a pretty somber thought.
Right, and I think a lot of times where, the camps that are in Tacoma, if you go down to the port, which I was down yesterday, there's camps are growing, looking pretty big when you go over towards Fife right now. So some of them, yeah, they're going to go deeper into the woods. Yeah, I think that's a great, and it's a tough question. And I think along with that, and along with Janet's point earlier, is when you talk about the safe car camping, and what we know is a lot of times that's where the families are. And that's where I think the children are a piece of this, where, gosh, you talk about unintended consequences. The children that are living in vehicles that have had a respite, they're saving grace as they get to go to school every day, right? Now what's happening with those kids?
Wow.
Right? That's a whole nother can of worms that I don't even know if I'm ready to open that one up, but that's real.
Yeah.
It absolutely breaks my heart listening to, I get to talk to hundreds of community members each week. And it definitely breaks my heart just hearing the stories and listening to the need. And I do get to hear folks who have stated to me that they are newly homeless and they're not being protected, even though they should not be being evicted, or, it's just, who do we tell, who acts on it? Like, how can we still help our community? So it's a lot. Speaking of stories, this is coming out the Q&A box. We've been hearing several stories of unprecedented levels of flexibility being granted by the government to provide services during this crisis. And I know Tacoma Urban League has benefited in a lot of ways, being able to launch a lot of new programs to serve the community, even during this crisis, and being able to retrieve funding to be responsive and to act fast. Do you all have any examples of this flexibility that you'd like to see made permanent? So not just during a period of crisis or a pandemic, but any of the flexibility you'd like to see sustain?
Well, I just didn't want to talk because I've been talking too much. This is Colin, but I think there's a lot of things. I think from doing this work through this lens, it's just, kind of as we've been talking about, it's suddenly we're looking at this population that we really have been accustomed and we ignore, or we other this population, and suddenly we're looking at this population in different ways, and we're trying to be it that it's attached to a pandemic, but we're still suddenly we're being forced to look at this population and talk about things like, evictions and things like that in different ways. So yeah, I think that there's a lot of things, even the parking stuff, like that's such a huge thing for people living out of their vehicles who, you get parking tickets, and then what do? Well, the city or state or whoever it is, they take your vehicle, and that's the last thing you have. So the fact that that's not happening, that's great. That stuff shouldn't. But I think that there's two sides to that. Also, I think that there's a check and a balance to it for sure. But I definitely think that there are things. The fact that homeless encampments aren't getting swept all over, just for this, that, and the other. Once again, I think there's two sides to that, because I think that it needs to happen, but it needs to happen in a very strategic and humane way. But the fact that that's not happening in some areas is I think that's good also. So I think there's lots of things like that. Yeah.
I think that if there's more investment in public health, then the data ought to suggest that things like rapid rehousing can result in things like higher education or high school graduation rates. So rapid rehousing seems to be a proven method to reduce homelessness, but also reduce the long-term effects of homelessness and the intergenerational and the trauma of homelessness. So a real investment in public health and in data in general. So that's why I'm real pleased that Dr. Hirschberg is here, because I love data, and Gerrit knows that. Data is key if we act on it.
Thank you. I'm going to send it back over to Pam unless there are others that would like to respond to this question. Thank you, Pam. I'll turn it over to you.
So, speaking of trauma, as Janet just mentioned, one of the questions we had was, what are the behavioral health issues that are being addressed, or that you see? I'm sort of taking the question that was asked and blending it in, braiding it in with this conversation. What are the behavioral health issues that you would expect to rise up from coronavirus, especially for our community of folks experiencing homelessness?
I can give an example that Gerrit can give intimate details about. Folks will be experiencing probably higher levels of depression and anxiety just across the board. You add homelessness to that, and you've got more severe manifestations of what depression and anxiety can look like. So people who have been diabetic are still diabetic. And if they are homeless, they're still homeless. And you add a layer of this burden of COVID onto it. And now we've got healthcare providers that don't want to necessarily see people in person. We've got maybe providers of other kinds of services that deal with substance use that might not want to see in person. They're willing to do this telemedicine, which is wonderful for maybe a lot of the population, but maybe not for those experiencing homelessness. I don't know that telemedicine is an answer to those who are experiencing homelessness. So you add extra layers of depression and anxiety from COVID onto an already vulnerable population, and we're going to have worse outcomes, not necessarily tomorrow, but my guess is they've cut another 5 years off their life, which is already at risk.
So, Jan, thank you for that was a very poignant response. So the question that I have in my mind, and I'm sure a lot of our listeners do, is what can we do as a community? What can we do in the face of COVID-19 as it pertains to our homeless community?
Well, this is Gerrit again. We can certainly expect more. We've largely underfunded homelessness in pretty dramatic ways for the past, 5 years, 10 years, I don't know, quite a long time. Like, we see 200 people come into homelessness in a given week, 300 people in a given week in Pierce County, and we have resources to help maybe a quarter of them. And so I think we need to understand the full need that our community has, and then very actively work to find the resources to serve that need. And that's city funding, that's state funding, that's private donor funding, that's federal funding, and bring kind of an approach we're using with COVID-19. Like, we're obsessed with the data, and we're obsessed with solving a problem, and we're throwing massive amounts of money at really important work to meet the need. Like, if you had told me that the Greater Tacoma Community Foundation could come up with like $6 million to serve people experiencing homelessness, like, I would have been like, no. Like, I didn't even think that world existed. And then you throw a pandemic in, and people are able to make that kind of money available to serve people that are homeless. So I've learned a little bit about us needing to expect more. And I'm going to throw my little other bit in, is that nobody's responsible for homelessness in Pierce County. When there's somebody on the ground having a heart attack and I call 911, somebody comes, right? And if somebody doesn't come, there's a really good reason why somebody didn't come to respond to that medical emergency. If somebody's homeless on this, right? Because as a community, we've said there's X amount of need, we're going to resource it, and we're going to make it so that people can be accountable to provide that service. With homelessness, we do not do that. With homelessness, if somebody is homeless, we say, well, I guess the shelters are full right now, so you're just going to have to be homeless a while longer. And nobody's accountable to the people that are homeless or to our community for making that happen, and nobody's resourced to be accountable. I'd love to see a world where we know what resources, we go out and get them, and then we hold ourselves accountable for taking care of our vulnerable community.
Even more so now.
Yeah, I kind of lost the question there with my diatribe.
That's okay. Excellent point. So that was our closing question. Colin, Dr. Hirschberg, Jan, would you like to weigh in? What do you see that folks can do in the community?
I think Gerrit just touched on it really good. I think my hope is that this is an eye-opening opportunity for us, and we really, to everything Gerrit just said, like, let's take this, because I think I do the work that I do because I want to create safer communities. I did that before the pandemic was here. I'm going to be doing it after the pandemic is gone. Homelessness, individuals experiencing homelessness are a huge part of our community, right? To have a safe community, we need to serve this population, because if they're not safe, then we're not safe, because we're a community, right? And I think that this is, if we're doing great on social distancing in our housed community, but our unhoused community is not, it's not like there's bubbles around these populations. That's going to affect us just as much as it's going to affect that population. So we need to me, my hope is that we really come together as a community, and it's from the funding. I think that Gerrit touched on it great. This is not going to go away. This is a problem that we have. And until we're really, truly ready to invest in it with words and actions, we're going to have a problem.
I can step in here for a closing one. And one is that public health, I am afraid that because public health is mainly a tax-based source of revenue, that because of the economic downfall, and the economic crisis that is hitting the population, everybody, that public health will go back to being not only underfunded, but even less funded than it is now. So I am afraid of funding for public health. And I'm afraid of funding for homelessness solutions and rapid rehousing and all of the infrastructure it takes for that, because there's also a perceived judgment call by some in the public. So until we can get messaging out, a strong messaging out that homelessness is everybody's problem, public health is everybody's solution, then I don't know that we can really have a better outcome in the future. I would hope that people believe in science. They believe in all sciences, including human science and social science. So I would just give a big shout out for better messaging on the positive outcomes that public health working with housing and all social determinants of health creates a better community for all of us. Amen. I'm done.
Thank you. Thank you.
Good.
Thank you. Dr. Hirschberg, do you have any closing?
It's hard to add much to that. I agree with that. I do just want to point out that, the virus itself didn't cause this problem. It really outlined the disparities and the weaknesses we have already in our society. And what I would hope that comes out of this is that we kind of change our focus, rather than looking at when we look at communities, not look at sickness in our communities, but really look at health in our communities. How healthy are our communities? And when you put it in that way, it really shows the weakest link. When one part of our community is not healthy, and this includes the homeless, it puts us all at risk. And I really think that if we can change that focus and really, change the disparity of what it means for one group of people to have good health care and another not to, overall, it would improve the overall health. And I think it makes this, even the people who have the most privilege in our community, it makes them healthier and safer. And so this is something that I really think that has to be changed in terms of our priority and how we allocate our resources.
Well, thank you. Thank you, Dr. Hirschberg, Jan Runbeck, Gerrit Nyland, Colin DeForrest, our panelists, and my co-host, Twyna Nobles. We are at the end of our session. We are certainly not at the end of this issue and this conversation. There has been a lot of issues that have been raised, and also some glimmers of hope in terms of the things that we can do right away, as well as be advocates for. I also want to thank everyone who called in to listen to this conversation. As Rob has already posted, an archive of this meeting will be posted tomorrow on the MDC website. And thank you again so much, all of you, for your participation. Have a good evening. Everyone take care. Good night.